usually when a patient comes in and we schedule them for surgery, we do post-op discussion, kind of what to expect when the patient has surgery and they go home from the hospital. Typically, our patients spend the night in the hospital 24 hours, and they're on a clear liquid diet for the first 24 hours. And then, as long as they're tolerating the clear liquid diet, we advance them to a full liquid diet. And we have a listing on our handout that has the types of foods you can have on a full liquid diet, and you'll go home on that for 72 hours. Part of the diet that we also want you to focus on, especially when you're on the full liquid portion and the mechanical soft, is also make sure that you are eating enough protein. So you can do protein shakes while you're on the full liquid diet and also while you're doing the mechanical soft, because your diet is going to be less than what you were doing before. So it's important that you get the right nutrients. You may want to take a multivitamin as well as you are going through the post-operative phase to make sure you're getting the nutrients that you need. After the 72 hours that you've been on the full liquids and you're tolerating that diet okay, with no regurgitation, trouble swallowing, then you are okay to move to what we call a soft mechanical diet. The soft mechanical diet is softer foods, obviously, things that you can eat and swallow easier. We usually ask you to start with scrambled eggs, mashed potatoes, applesauce, something like that, and see that goes down okay. And if you're doing those types of foods and you're not having any issues, then you're okay to start following the diet a little bit further. And we have a list on our handout of foods that you can eat and what you should stay away from. However, if you are having issues with swallowing, things are getting stuck still, then you'll want to stay on the full liquid diet for another day or two until things heal up a little bit more and inflammation has gone down, and you can start eating a little bit more of the softer mechanical diet. There's a few things that we want you to avoid during the post-op period. Carbonated beverages, it's very important you stay away from carbonated beverages for about 8 weeks after surgery. It's very common to have bloating, gas. That kind of discomfort is normal. You can expect to have that. You will be prescribed simethicone or Gas-X, and you'll need to take that 4 times a day. It's very important that you take that medication to help with the bloating. It will help keep it down. But you will have it, so don't be surprised when you go home and have bloating and some gas. It's normal. Also, when we say soft mechanical diet, you would think that you can have soft breads, but we highly advise that you do not eat soft breads. When you chew those up, they can form a ball. We call it a bolus. It's very sticky and it can get stuck in your esophagus. And if it gets stuck in your esophagus, it's something that you'd have to go to the hospital for to have it removed. So stay away from soft breads. So we just tell the patients to continue following mechanical diet until you follow up with your first post-op appointment with Dr. Smith, and that's typically about 2 weeks after surgery. So he will see how you're feeling, assess the diet that you've been on, and then if everything is going well, you'll be able to start eating regular food at that point. And then you'll come back and see him again about 6 weeks after surgery for your final post-op visit. So some of the typical calls we receive after surgery is related to moving your bowels. Anesthesia slows your bowels down. When you're on narcotic pain medication, which you will be on after surgery for a few days, they will slow your bowels down. It's very normal to not have a bowel movement for a few days because you're not eating as much food as you were. So if you have not gone after about 3 days and you feel like you need to go and you cannot, you will need to take some Miralax, and you can do that 2 to 3 times a day, or milk of magnesia. So it's whatever your preference is. Milk of magnesia 1 to 2 times per day. So it's up to you. You get it over the counter. You do not need a prescription, but you do need to take something to get your bowels moving. Also make sure you're drinking plenty of fluids. Some of the other issues we run into, patient may have trouble swallowing and thinking that they cannot advance their diet or they're not ready to, and then we refer them back to starting back on the full liquids again until they're able to swallow a little bit better and the inflammation goes down. Sometimes they also require more pain medications. You would need to call into the office and discuss that with the nurse, and so we can talk to Dr. Smith about more pain medications for you. There's other issues that you may have after surgery, and that may include some shoulder pain, and that is related to the gas they use when they inflate your belly during surgery. That helps the surgeon see your anatomy better on the inside. So it's normal to have pain up in your shoulder. The best thing you can do for that is to get up and move around. Gas X probably will not fix that. You definitely need to get up, walk as much as you can. I know that you're going to have some pain related to your incisions, but we do want you to move, and the more you move, the faster that gas will go away.